Hey everyone, and welcome back. If you're a nursing student, you are in the right place. Today we're going to tackle a skill that seems super basic on the surface, but trust me, it is packed with clinical gold. We're talking about assessing respirations. Nailing this skill isn't just about checking a box in clinicals. It's about spotting trouble before it becomes a full-blown crisis. So, let's dive in.
So think about it for a second. With most vital signs, you can be pretty direct, right? You can ask what's your pain level, you put a cuff on for blood pressure, but breathing, that's a whole different ballgame. This is the one vital sign that requires a little bit of stealth, because the second your patient knows you're counting their breaths, I promise you, their breathing pattern will change.
And hey, real quick, if you're finding these explainers helpful on your nursing journey, do me a huge favor. Hit that like button, subscribe to the channel, and maybe share this with your study group. Our whole goal here is to help you walk onto that hospital floor feeling totally confident and ready for anything.
All right, so here's our game plan. We're going to start with the why this matters so much. Then we'll walk through how to prepare and actually perform the skill. And we'll wrap up with the really important critical thinking stuff. How to interpret what you see, what to do about it, and how to chart it properly. Let's get to it.
So why do we even care so much about counting breaths? Well, because a patient's breathing, the rate, the rhythm, the effort, it's like a direct window into their overall health status. It's often one of the very first signs that tips you off to big problems, like low oxygen, a change in their blood pH, or even a reaction to medication. This isn't just counting, you guys. This is critical assessment.
You know, a perfect assessment doesn't start when you walk in the room. Nope, it starts way before that. Getting prepared is what really separates a beginner from a pro, and it sets you up to get a perfect, accurate reading every single time.
Your very first stop should always be that patient's chart. You need to be a bit of a detective. You know, what's their history? Do they have something like COPD? What medications are they on? Opioids, for example, can seriously slow down breathing. What did their last set of vitals look like? And what about labs? Knowing their blood gas or hemoglobin levels gives you huge clues. All these pieces help you build a mental picture before you even say hello.
Next up, let's get our gear. It's pretty simple. You need a watch with a second hand. You might want your stethoscope handy, just in case. And of course, your PPE for safety. But here is the one thing you can never, ever forget. Check for allergies. Seriously, this is absolutely crucial. You don't want to be the person who causes a reaction just by walking in the door.
All right, you've done your homework, you've got your gear, now it's showtime. Let's head into the patient's room. This is where it all comes together. Your hands-on skills and your people skills. This is the clinical encounter.
Okay, these first 4 things are your entry ticket. They are non-negotiable, every patient, every time. Pull that curtain for privacy. Introduce yourself, it builds trust. Wash your hands, that's a given. And then, confirm you have the right person using 2 identifiers, like name and date of birth. This foundation of safety and respect really sets the tone for everything else you're about to do.
Now listen up, because this is probably the biggest pro tip for this whole skill. Like we said, you can't let your patient know you're counting their breaths. So here's the trick. You do it right after you take their pulse. Just keep your fingers on their wrist like you're still feeling for their radial pulse, but you shift your eyes to their chest. It's a seamless move, and they'll have no idea you've switched gears.
Okay, so you're in position, pretending to take their pulse. Make sure you can actually see their chest rise and fall. Remember, one breath is one rise and one fall of the chest. If their breathing seems nice and regular, you can count for 30 seconds and just multiply that number by 2. But, and this is a big but, if it's irregular at all or if they're pretty sick, you have to count for a full 60 seconds, no shortcuts. And you're not just counting, you're observing. Is the breathing shallow or deep? Is the rhythm regular? And is it effortless, or are they working hard to breathe?
So, you've got your number, you've made your observations, now what? This is where you put on your critical thinking hat. What does a rate of 24 with shallow breaths actually mean for this patient right now? Let's break down how to make sense of it all.
First things first, normal completely depends on age. Just look at this chart. A newborn breathing 50 times a minute? Totally fine.
An adult breathing 50 times a minute? That's a major emergency, so you absolutely have to compare your finding to the right age group. This is one of those charts you'll want to just lock into your brain. It'll serve you well your entire career for sure.
All right, let's talk lingo, because using the right words is a huge part of being a pro. If the rate is normal, that's called eupnea. If it's too fast, it's tachypnea. Too slow, bradypnea. And if they stop breathing altogether, even for a moment, that's apnea. Knowing and using these terms makes your documentation and your report to the doctor so much clearer. Okay, we are on the home stretch. You've done the assessment, you've interpreted what you found. Now you have to do something with that information. This is all about taking action and then closing that communication loop with good documentation.
So this is the big question, right? The one that makes your stomach do a little flip when you're new. You've counted a rate of 28 in an adult, or you see that they're using all their neck muscles just to take a breath. What do you do right now?
Here are your first moves. First, sit your patient up. That's the quickest way to help open up their lungs. Then, look for other signs of low oxygen. Are they getting restless? A little confused? Is there something simple you can fix? Maybe their pain is out of control, or they're having an anxiety attack? Try to address that. And finally, you have to pick up the phone and notify the provider. Your assessment is the trigger that gets the ball rolling on more help.
You know the saying, if you didn't chart it, it didn't happen. And it's so true. Your documentation needs to paint a full picture. Don't just chart RR22. Chart the rate, the depth. Was it shallow? The rhythm and the effort. Was it labored? Use those fancy terms we just learned. This gives the next nurse, the doctor, everyone on the team a crystal clear idea of what's going on with your patient.
Honestly, getting skills like this down cold is exactly what's going to get you through your exams and, eventually, the NCLEX. If you want more tools to help you study, we've actually put together some awesome summarized revision books for all your nursing courses. Just check out the links down in the description below.
So, I'll leave you with this final thought. A number is just a number. The real art and science of nursing is looking beyond that count and asking yourself, what is this patient's breathing really trying to tell me? Keep asking that question